Hello everyone. Today I'm back with another obstetrics case. This is the sixth case and it is a case study on raised alpha-fetoprotein, also known as elevated AFP. So this is a condition where a protein known as alpha-fetoprotein is raised in pregnant women, and this is supposed to cause, or it could be the cause of chromosomal abnormalities in the fetus. Let's learn in detail about this condition through a case. Our patient is a woman aged 23 years who was referred by her general practitioner to the antenatal clinic for her screening, and she was 14 weeks in her first pregnancy. She has booked late, having only just discovered she is pregnant. Although the pregnancy was unplanned, she is now happy about it. She has no significant medical history, and she is one of four siblings. On direct questioning, she told that her mother had a stillbirth attributed to some form of congenital abnormality 28 years ago, and otherwise the pregnancy is assessed to be low risk. So she arrived at the antenatal clinic for her screening, and she's too late for a nuchal translucency test. So this is a test performed where there are nuchal folds that is seen in a fetus. These folds are present behind the neck of the fetus and it is measured. The size of these folds are measured. If the size is increased, there is a higher chances of chromosomal abnormality, and this test is performed to detect any chromosomal abnormalities in a fetus. This test is performed around 11 to 14 weeks, but since our patient has passed this gestational period, she's too late for a nuchal translucency test. So she's offered a serum screening for Down syndrome, which she agrees to, and this serum screening was performed at 17 weeks. So for knowing or for assessing Down syndrome in a fetus, there is a group of tests which is known as the triple test, and this test involves measurement of alpha-fetoprotein or AFP, estriol, and beta HCG, which is also called human chorionic gonadotrophin. So all these lab parameters are performed in this pregnant lady, and her alpha-fetoprotein is 3.36 multiples of the median. So firstly, what is alpha-fetoprotein? It is a protein produced by the liver of the fetus, and it is usually high in case of pregnancy, and it is measured with respect to multiples of median or MOM. So there is median is a middle value that is usually observed in a large number of population, and the patient's values is compared with the median value, that is the patient's level, and the population's ratio is taken, and hers is 3.36, which means it is 3.36 times higher than the median value or the middle value. So we can see that the AFP levels are highly increased in this patient. Her estriol and HCG are somewhat normal. So on assessment, in this case, we can see that the AFP is significantly raised, and increased AFP is associated with an increased risk of fetal abnormality. The common abnormalities are neural tube defects. This involves an opening in the spine or cranium. Spinal cranium of the patient, and this causes abnormal growth or intellectual abnormalities in the patient. The second abnormality is anterior abdominal wall defects and Patau syndrome, also known as trisomy 13. So in this case, the chromosomal pair number 13 has an extra chromosome. So it causes Peters syndrome. This antenatal screening was performed to assess whether the patient has Down syndrome or not. For the fetus to have Down syndrome, the AFP is usually decreased, but in this case, it is raised. So the fetus does not have Down syndrome, but the fetus has a possibility of having either neural tube defects or anterior abdominal wall defects or Patau syndrome. Let's learn in detail about this condition. This is an image, maternal AFP and its significance. So in maternal circulation, the AFP levels are at peak between 13 to 16 weeks. Our patient is 17 weeks in gestation, and in the amniotic fluid, the peak of AFP is around 14th week, and significantly raised AFP causes neural tube defect. As we can see in this fetus, there are spinal abnormalities or cranial abnormalities. Elevated alpha-fetoprotein refers to a state where the AFP levels are outside of the reference range. That is, it is abnormally high. In this patient, it was 3.36 times the median level. To perform AFP tests, there are two categories. One we can perform on the maternal serum, and the second could be performed on amniotic fluid. As we can see in this image, amniotic fluid has a peak around 14th week, and maternal circulation has around 13 to 16 weeks. That is why our patient took this test at around 17 weeks. And in our patient, amniotic fluid was not assessed, only the serum test was performed. So abnormally elevated AFP in the serum of a pregnant woman can have one or more of these sources. What are the causes that might cause abnormally elevated AFP? It could be a problem with the fetus, maybe any neural tube defect or abdominal wall abnormality. Maybe there is a problem with the placenta. The maternal AFP might have been transferred in the amniotic fluid, or maybe the amniotic fluid containing AFP could have been transferred to the maternal plasma. So there could be a problem with the placenta. A tumor or liver disease, since this protein is produced by the liver, liver disease might cause abnormal elevation, or maybe a tumor that secretes this protein. And a normally elevated AFP in the fetus of women. So some people naturally have very high AFP. So maybe this patient had naturally high AFPs. It depends with patient to patient. Maternal serum AFP varies by orders of magnitude during the course of a normal pregnancy. So during the pregnancy, at around the first trimester, it is not very high, but around the second trimester, AFP levels increase. And then after the pregnancy, after the delivery of the baby, the AFP level falls back to the normal levels. So it changes during the course of a normal pregnancy. If a woman is already getting a test for Down syndrome screening, then the AFP marker that is part of this test provides the screen result for neural tube and abdominal wall defects. So this test is usually performed for Down syndrome. Down syndrome is also known as trisomy 21. So as we know that humans have 23 pairs of chromosomes. So there is a chromosomal pair 21, and trisomy 21 refers to, usually we have two copies of 21, this pair of chromosome, but if in a fetus there is a third copy, either a part of third copy or a fully third copy seen in a patient, then they have Down syndrome. And Down syndrome causes physical and intellectual disabilities, and even as a full-grown adult, the patient has the characteristics of a 8 to 9 year old and the intellectual abilities of a child, and they are highly emotional. So this test is performed to assess if the fetus has Down syndrome or trisomy 21 or not, and the parent usually chooses if they want to abort the fetus in case of a trisomy. But for Down syndrome, the AFP is usually in low levels. In this patient, this is not the case. It is elevated, and Elevated AFP is related with neural tube defects and abdominal wall defects. Genetic counseling is further offered when the screening test result is positive. So, how to manage this condition? This patient should be referred to a specialist fetal medicine center for a detailed ultrasound scan to exclude any significant neural tube or abdominal wall defects. As we had seen in the causes of elevated AFPs, maybe the patient already had a normally high AFP level, so a detailed ultrasound scan should be performed. And if we can see any sort of neural tube or abdominal wall defects, then we can inform the patient, and then the mother can choose whether she wants to keep this pregnancy or not. One of the problems with serum screening is that other pregnancy complications may lead to a higher level of AFP. So, other pregnancy complications that contribute to this condition are multiple pregnancy, fetal intrauterine growth restriction, where the fetus is unable to grow according to its gestational age, and oligohydramnios. Finally, the normal range is dependent on gestation, and unless the gestational age has been confirmed, the AFP may be high because the pregnancy is more advanced than presumed. If there is a mistake in calculation of the gestational age, if there is a miscalculation of the ovulation time or in the last menstrual period, if there is a miscalculation in the gestational age, then there could be a problem in assessing the AFP levels since AFP level change during the course of pregnancy. So the patient should further be assessed for her gestational age, whether it is accurate or not, and accordingly, a proper diagnosis should be taken, and the patient should be informed about the options if there are any defects or whether it is normal. AFP is also affected by ethnic background, maternal diabetes, and maternal liver disease. The normal range is dependent on gestation, and as I had told, we need to confirm the gestational age. So that's it for today's session. Thank you for watching, and please share this video. Thank you.